This weekend's Leeds and Reading festivals are amongst the first to have banned the sale of legal highs at their sites. Let's get more on this. I'm joined by Dr. Adam Winstock, who's a consultant addiction psychiatrist and founder of the Global Drug Survey. A very good morning to you. Thanks for talking to us. Do you think these festivals have taken the right step?
Listen, I think they've been put in a difficult position. Obviously, they don't want people dying at their festivals, and it's a tragedy when young people die. So I think that they've probably done what they can to try and minimise the risk. But of course, that doesn't mean that people won't be taking these drugs at the festival, or drinking excessively, or taking a range of other already illegal substances.
Well, yes, and some people will be confused about why some of these substances are legal. There are a huge number on the market, aren't they? Some are deemed illegal, some aren't. Why is that?
Well, I mean, we have drug laws in this country, and in order for a drug to be made illegal, it has to kind of go through an act of parliament. And there's a whole range of drugs that can affect your brain in diverse ways that simply haven't been regulated yet. And the way that manufacturers and sellers get round coming under any sort of regulation is by having that stamp of not for human consumption. But that same stamp is also the stamp that means they actually can't provide information on the packet that could potentially reduce the risks to people by giving information over things like dose, effect and risks.
Well, yes, and with more drugs being produced every week with a slightly different chemical composition but with similar effects, how do you then go about minimising the risks? I mean, how do you tell people how dangerous they are?
Well, I mean, I think the reality is you say, we don't know how dangerous these things are, but there are some common sense principles that you can apply to keep yourself a bit safer. Clearly, the first one is don't take them. But the reality is people are always going to take drugs, and good government public health policy is going to be that policy that supports people to take those things more safely. And that's information provision. I would be telling people who are taking a new drug for the first time to make sure they have people around them who aren't under the influence, to make sure they're in a safe place, to make sure that they take the smallest, tiniest amount of a substance that may be incredibly potent at very small doses, not to take those new drugs with other substances on board, particularly alcohol, and particularly don't redose with those new substances for at least a couple of hours. The truth is most people who die from these substances don't die from them in isolation. They die when they mix them with other substances and alcohol.
The problem is that as soon as you start giving out advice on how to take drugs, it sounds like you're condoning the use of them, and some people might say that encourages people to think that it's okay to go ahead.
I mean, I don't really agree with that. I think the majority of drug users aren't daft. They don't want to engage in an activity that places either themselves or other people at risk. A lot of these people will otherwise be responsible members of society, and for them, their drug and alcohol use is one of a number of recreational activities that they engage with. I think giving good information provision to people treats them as adults, and that's the first step to getting people in a dialogue about the potential risks they might be exposing themselves to. And you need an open dialogue with people who like using drugs if you have any hope of them taking anything that you say with any credibility at all.
OK, Dr. Adam Winstock, appreciate your time. Thanks for talking to us today.